Hey guys, welcome back. Today we're going to be discussing which US presidents have had skin cancer, who's on the list, and who didn't make the list. Might surprise you. So let's jump right into it and check it out. Before we get started, I'm Dr. Dustin Portela. I'm a board-certified dermatologist, and I've helped millions of people online through my social media channels to take better care of their skin, better care of their health in general, and it's my goal to help you be beautiful and healthy inside and out. Now with that being said, let's take a look at the list. Now the first skin cancer scare comes from Dwight Eisenhower. President Eisenhower's physician noticed a black spot on his back and recommended immediate removal because he was concerned about malignant melanoma. Malignant melanoma is one of the most deadly, if not the most deadly form of skin cancer, and because of its risk, it does need to be treated early and aggressively. So President Eisenhower's physician took off what was described as a generous sample of skin and subcutaneous fat, which is what you want to do with melanoma. You take a big sample, you got to get it out of there. He took it to the lab and the pathologist told him that this was crazy because it was just going to be a benign seborrheic keratosis, which is one of the most common things that we see growing on more elderly people, and they are benign. They're not cancerous, they never turn into skin cancer themselves. And so the pathology results came back, and this was diagnosed as a seborrheic keratosis, not cancerous. But the kicker here is that it seems that nobody told President Eisenhower the results, because years later when he was delivering a speech, he referenced his physician and thanked him for saving his life and removing what was a malignant growth on his back, but it never was malignant. So although this wasn't a skin cancer in this case, it was a skin cancer scare, and that takes us to the first documented skin cancer of a US president, LBJ. Now we have to look at the pattern that will start to develop here. We had Dwight Eisenhower, he was in the military, spent tons of time outside. Then we have LBJ, also an elderly white guy, and you're going to notice that that's kind of a recurring theme here. Now LBJ had skin cancer while he was president of the United States, but he didn't tell anybody about it because they were worried that a cancer diagnosis in the president would cause a lot of concern among the population. So information about his cancer diagnosis was not revealed until after he was out of office. And he actually had two different skin cancers. The first was a basal cell carcinoma from his middle finger on the right hand. So they were able to remove that, clear margins, never was a problem for him. And the second skin cancer that came up was just on the outside of his left ankle, just above that ankle bone, what we call the lateral malleolus. So he actually had two skin cancers that were treated while he was in office, told no one in the press or public, and it was revealed after the fact by his physician with the permission of his wife. Next, as we move in chronological order, we're going to take a look at Richard Nixon. Now, Richard Nixon did not suffer from skin cancer while he was president, but following his presidency, he was diagnosed with a basal cell carcinoma behind his left ear, and that was removed by a dermatologist at Cornell Medical Center in what was described as a 4-hour procedure. This happened in about 1985. Based on the length of time that that procedure took, I can only assume that he went through Mohs micrographic surgery, which is a very specialized and technical way of removing skin cancer that we use primarily for areas of the body that are highly cosmetically sensitive. So areas of the head and neck almost always qualify for Mohs surgery, the backs of the hands, over the shins, tops of the feet, and on the genitalia. Those are the areas you're most likely going to see Mohs micrographic surgery performed. And basal cell carcinoma is far and away the most common type of skin cancer that we as dermatologists diagnose and treat. And again, Richard Nixon fits the bill of the most likely demographic that's going to get these, especially in later years of life. Now, President Nixon's tumor was described as being really big. It was quite big, and his surgeon had to do a skin graft where they took skin from his left shoulder and placed it on his scalp behind his ear. Dr. Priolu at Cornell Medical Center performed that procedure, and to my knowledge, that was the only skin cancer on President Richard Nixon. As we continue, we would be looking at Gerald Ford, but in all of my research, I didn't find any evidence that President Ford had any skin cancer. If any of you know differently, please let me know in the comments below. However, we can continue on after President Ford. We have Jimmy Carter. And like President Nixon, Jimmy Carter did not have skin cancer while he was in office, but in the last decade, he has been diagnosed with melanoma. And this melanoma likely started in his eye, or what we call an unknown primary, meaning we don't really know where it started. But it appears from all the research that I can do is it started in his eye and spread to his brain, and so that may not technically make it a skin cancer in this instance. Melanoma is commonly a skin cancer, as we have previously discussed. So I'm going to put this in the skin cancer category for President Jimmy Carter. Now, thankfully, even at his advanced age, he's doing really well. He's had immunotherapy, and even though his cancer had spread to his brain, he appears to be cancer-free at this time, and we continue to wish him well and appreciate the good work that he's doing in the world. As we continue, we're now to Ronald Reagan. Now, Ronald Reagan did have skin cancer while he was president. He was diagnosed with a basal cell carcinoma on his nose. Now, it was his intention to have this treated and to kind of lay low, let everything heal up, and maybe not necessarily inform the public at large. Now, again, basal cell carcinoma is a very common type of skin cancer, and it's easily treatable. It almost never leads to death. So his decision to maybe want to hide that, I can understand maybe from a cosmetic standpoint as a former Hollywood actor. Now, there was a complication with his plan because around the time that he was having that treated, a cruise ship called the Achille Lauro, and I may have butchered that name, was hijacked. And so this was a national incident, and he had to go on national TV to make a statement the following day, and he did so with a bandage on his nose. And he was asked about this, of course, and he said, "This is just a reminder or your billboard to stay out of the sun." So Ronald Reagan did have skin cancer, and it was treated while he was president, and he did talk about it while he was president. Now, next after Ronald Reagan is George H.W. Bush. Now, George H.W. Bush was the vice president under Ronald Reagan during his second term, and he went on to become the president. Now, George H.W. Bush did not have skin cancer while he was president of the United States, but during his time as the vice president, he was treated again for a basal cell carcinoma on his left cheek. I didn't find a lot of details about this one. I assume that he was also treated with Mohs micrographic surgery, and he made a full recovery, and the scar, as far as I can recall, looking at images from him, was really not noticeable. So he healed very well. It probably wasn't a really big tumor, and that's the only one that I'm aware of that he developed. Now, we know that after George Bush, Bill Clinton took office and did 2 terms. Now, Bill Clinton, also being in the demographic that's most likely to get skin cancer, did end up with, you guessed it, basal cell carcinoma. We're seeing a theme here, aren't we? He had a basal cell carcinoma that was identified and treated in the last week of his presidency before George W. Bush took over. Now, this was treated by what's called an electrodesiccation and curettage procedure, commonly called a burn and scrape procedure. Now, based on this information, having a cancer on his upper back that was treated by a burn and scrape procedure, this is likely something called a superficial basal cell carcinoma, where the skin cancer cells were only in the top layer of the skin and were not invading deeply into the deeper layers of the skin or the subcutaneous fat. And it was reported that he had a full recovery from this with no recurrence of the cancer, so it's likely that this was caught early and was not at an aggressive stage yet. Now, since leaving office, it's been reported that Bill Clinton may have had additional skin cancers and that he has gone through a number of treatments for precancerous skin lesions using cryotherapy or a freeze gun that we commonly use in the clinic. Now that we've passed by Bill Clinton, let's take just a minute and talk about the way that you can protect yourself from developing skin cancer. And the number one thing that you can do is to avoid excess ultraviolet light exposure. UV light is one of the most common ways that increases your risk of skin cancer, especially if you're getting significant sunburns at early stages in life, especially like in childhood or young adulthood. I wasn't very smart when I was in high school or even in college, and I did a lot of distance running with the shirt off, and I'm always worried that I'm going to pay for that. My habits are much better now, and I put on sunscreen every day. I wear wide-brimmed hats, and I often wear sun protective clothing or UV protective clothing that covers down to my wrists. You can do some of those same things. If you're interested in checking out some of my favorite brands and products and the stuff that I recommend to my patients in the clinic, you can check that out at 208skn.com, 208skin.com. I'm going to link to a couple of my favorite sunscreens from that line that I recommend to my own patients every day. Next up is George W. Bush, and I did a ton of research looking into this, and I could not find any evidence evidence that, as far as has been publicly released, that he's had skin cancer. Now, he did have a history of precancerous polyps that have been treated. He does get regular colonoscopy screenings, and he has had benign lesions removed from his forehead, but nothing that I can find that would indicate that he's had skin cancer. So maybe he was a little bit better about wearing sunscreen than his dad. Honestly, George W. Bush was one that surprised me. I just thought that he would be, like his dad, get skin cancer. He's in the demographic that's most likely to get it, but he has not made the list, and I hope he doesn't. Continuing on our presidential journey, we come to Barack Obama. Now, as expected, or maybe not surprising, he has not had skin cancer, at least not anything that has been released, and he's certainly not in that classic demographic of elderly white guys that get skin cancer. So he is much less likely in his demographic to not develop skin cancer. But one thing that is important to know in the general population, that darker skin types that are diagnosed with skin cancer tend to have delays in treatment, delays in diagnosis, because there isn't enough education in identifying those, or they're just not caught early enough because the patient, the doctor, the whole medical system just don't anticipate that a skin cancer diagnosis is going to be very common there. Now, if you do have darker skin, it is important still to do self-skin checks, and some of the areas that are most important to look at when checking yourself for skin cancer are going to be under the fingernails and on the palms and the soles. Acrolentigenous melanoma, as it's called, often has a delay of diagnosis in any skin color, but it's the more common type of melanoma to occur in darker skin types, and it can be highly lethal. So make sure that you're checking yourself as well. So again, not surprising, Barack Obama, no skin cancer. Now we come into 45, Donald Trump. Now, does this orange hue protect him from skin cancer, or what is going on there? Because everywhere that I've found, he hasn't had skin cancer, and he spends a lot of time on the golf course. But there's no record of him anywhere publicly that I can see having been diagnosed or treated with any type of skin cancer. Now, at his age, being in his late 70s, he's still certainly at risk, depending on the length of his life. So it's something that could happen because he's spent a lot of times outdoors. So we'll keep an eye on that. If I hear of anything, I'll definitely let you know. And that brings us to our last president and current president, Joe Biden. Now, a little while ago, he had a little gaffe in the media where he talked about that he and everyone he knows has cancer. And he was talking about cancer prevention and some of the things that he may have been exposed to growing up. And the White House press room came out and said that this was a mistake, that he misspoke, that he does not have cancer, thankfully, but that he previously to getting in office as the president had been diagnosed and treated for more than one, it sounded like, non-melanoma skin cancers. And again, that's most likely to be basal cell carcinoma and squamous cell carcinoma. They didn't specifically identify which types of cancer that he had had or where they occurred. As I look at pictures of Joe Biden, I suspect he may have had one or two near his nose, but I can't be certain. That's entirely speculation on my part. So there we are. Those are the US presidents who have had skin cancer. Did anybody on that list surprise you or not surprise you? Let me know down in the comments. And again, the most important thing you can do is to protect yourself from skin cancer. If you think somebody else might find this video interesting, please go ahead and share it with them, and let me know other topics you might like to learn about in the future. Thanks for tuning in. I'll see you guys on the next video.